Maya Chen had been working at the front desk of Riverside Medical Center for 3 years. She knew the rhythm of the emergency department like the back of her hand. Tuesday mornings were usually quiet, with only a few patients trickling in before the lunch rush. She sat behind her computer screen, checking people in, answering phone calls, and making sure everyone got the help they needed. The automatic doors slid open at exactly 9:30. A woman walked in supporting a teenage boy who was bent over, clutching his stomach. Maya looked up immediately. The woman was black, probably in her mid-40s, with worry etched deep into her face. The boy looked about 16, tall and thin, and clearly in serious pain. "Please, we need help," the woman said, her voice tight with concern. "My son Marcus has been throwing up all night. His stomach hurts so bad he can barely stand." Maya stood up quickly. "Come right over here. Let's get him registered." She grabbed a wheelchair and helped Marcus sit down. His face was covered in sweat and he was taking short, shallow breaths. Maya had seen enough emergency cases to know when something was serious. "This looks serious. What's your name, sweetheart?" Maya asked gently. "Janelle Williams," the woman replied. "And this is Marcus. He's 16. The pain started yesterday afternoon, but it got really bad around midnight." Maya typed quickly, asking all the standard questions. "Where was the pain?" "Lower right side of his abdomen." "Any fever?" "Yes, about 102 degrees. Vomiting multiple times." "Loss of appetite?" "He hadn't eaten since yesterday morning." Maya's mind was already connecting the dots. She had worked in hospitals long enough to recognize the signs. This sounded like appendicitis. Marcus needed to see a doctor right away. "Okay, I'm going to get you back there as soon as possible," Maya said, printing out Marcus's wristband. She flagged down a nurse. "We need a room right away. Possible appendicitis." The nurse nodded and took Marcus and Janelle to an examination room. Maya watched them go, hoping they would get quick treatment. She returned to her desk and continued with her work. But she kept an eye on the assignment board to see which doctor would take Marcus's case. 10 minutes later, she saw the name appear on her screen, Dr. Richard Castellano. Maya felt a small knot form in her stomach, though she couldn't quite explain why. Dr. Castellano was a senior physician who had worked at Riverside for over 15 years. He was known for being efficient and smart. Other doctors respected him. He never wasted time. But there was something about him that always made Maya uncomfortable. He was cold, distant, like he saw patients as problems to solve rather than people to help. She pushed the feeling aside. Dr. Castellano was a good doctor, she told herself. Marcus would be fine. About 20 minutes passed. Maya was helping another patient when she heard raised voices coming from the examination area. She looked up and saw Dr. Castellano walking out of Marcus's room, his face showing irritation. Behind him, Maya could hear Janelle's voice pleading. "But doctor, please, he's in so much pain. Can't you do more tests?" Dr. Castellano didn't turn around. He walked to the nurse's station and started writing something on a chart. Maya couldn't hear what he was saying, but she saw him hand a prescription to one of the nurses with a dismissive wave of his hand. A few minutes later, Janelle emerged from the examination room. Supporting Marcus, who looked even worse than before, she walked up to Maya's desk, her eyes red and frustrated. "We're being sent home," Janelle said, her voice breaking. "The doctor said Marcus is just exaggerating. He gave us some pain pills and said to rest." Maya's mouth fell open. "What? But his symptoms—" "I know," Janelle interrupted, tears starting to form. "I told him Marcus has never complained like this before. I told him about the fever, the vomiting, everything. He barely looked at him. He was in the room for maybe 3 minutes. Maya felt anger rising in her chest. 3 minutes? For symptoms that serious? She glanced at her computer screen and pulled up Marcus's file. Dr. Castellano had written, "Patient presence with abdominal pain. Likely gastric distress. No acute symptoms observed. Prescribed ibuprofen. Advised rest and hydration. Return if symptoms worsen. No acute symptoms." Marcus could barely walk. How could Dr. Castellano miss that? "Mrs. Williams, maybe you should ask for a second opinion," Maya suggested carefully. "I can page another doctor." "I already asked," Janelle said, wiping her eyes. "He said it wasn't necessary. He said I was being overprotective and that teenagers sometimes act dramatic when they have stomach aches." She let out a bitter laugh. "Dramatic? My son is burning up with fever and can't stand straight, and he called him dramatic." Maya didn't know what to say. She wanted to help, but what could she do? She was just a receptionist. Dr. Castellano was a respected physician. Who would believe her concerns over his medical judgment? "I'm so sorry," Maya said quietly. "Please, if he gets worse, come back immediately." "Don't wait." Janelle nodded, though she looked defeated. She helped Marcus toward the exit, practically carrying him. Maya watched them leave, feeling helpless and angry. She tried to focus on her work, but she couldn't stop thinking about Marcus. Something was very wrong with what just happened. She had seen Dr. Castellano treat patients before, and he usually ordered tests, took his time, and gave thorough examinations. Why had he dismissed Marcus so quickly? About an hour later, another teenage boy came in with his father. The boy was white, around the same age as Marcus, and he was complaining of stomach pain too. Maya processed his intake and watched as he was assigned to Dr. Castellano as well. Maya found an excuse to walk past the examination rooms about 30 minutes later. She could hear Dr. Castellano inside, talking patiently with the boy and his father. Through the small window, she could see him pressing gently on the boy's abdomen, asking detailed questions, and listening carefully to the answers. "I want to run some blood work," she heard Dr. Castellano say, "and let's get a CT scan just to be safe. Abdominal pain in teenagers can be tricky. Better to check everything thoroughly." Maya's blood ran cold. The same doctor who had spent 3 minutes with Marcus was now spending over half an hour with this patient. The same doctor who had dismissed Marcus's pain as exaggeration was now ordering multiple tests for similar symptoms. She walked back to her desk slowly, her mind racing. Maybe it was just a coincidence. Maybe there was something different about the cases that she didn't understand. Maybe Dr. Castellano had a good reason for treating them differently. But deep down, Maya knew what she had witnessed. She had seen the dismissive way Dr. Castellano had treated Janelle and Marcus. She had seen the care and attention he was giving to this other family. The only difference she could see was the color of their skin. Maya sat down at her desk and pulled out her personal phone. She opened her notes app and started typing. She wrote down everything she remembered: the time Janelle and Marcus arrived, their symptoms, how long Dr. Castellano spent with them, what he said, what he prescribed. Then she wrote down the details of the second case. She didn't know what she would do with this information. She didn't know if anyone would care or believe her. But something inside her said she needed to keep track. This might not be the first time Dr. Castellano had done this, and it might not be the last. As Maya continued her shift, she couldn't shake the image of Marcus's face, twisted in pain, being sent home with nothing but over-the-counter pain medication. She thought about Janelle's tears, her frustration at not being heard or believed. Maya had always tried to stay out of trouble at work. She did her job well, kept her head down, and didn't get involved in drama. But now she wondered if staying silent was the right choice. What if Marcus got worse? What if something terrible happened because Dr. Castellano hadn't done his job? The questions haunted her for the rest of the day, and she knew they would follow her home that night. Maya couldn't sleep that night. She kept thinking about Marcus and Janelle, wondering if they were okay. Every time she closed her eyes, she saw Marcus bent over in pain, and she heard Janelle's desperate voice asking for help that never came. By morning, she had made a decision. When she got to work, she would pull up old patient files and see if there was a pattern. She needed to know if what she saw yesterday was just a one-time thing or something bigger. Maya arrived at the hospital early, before the morning rush. She logged into her computer and started searching through records. She had to be careful. She couldn't access detailed medical information. That would be a violation. But she could see basic intake information, which doctors saw which patients and how long they spent in examination rooms. She started with the past year and focused on Dr. Castellano's cases. At first, everything looked normal. Then she started to notice something. She pulled up cases side by side, comparing them. There was Mr. James Thompson, a 72-year-old black man who had come in 6 months ago with chest pain. Maya remembered him. He had been clutching his chest, sweating, looking terrified. Dr. Castellano had seen him for 8 minutes and sent him home with antacids, diagnosing acid reflux. 3 days later, Mr. Thompson had returned in an ambulance, having suffered a heart attack. He survived, but barely. Then there was Maria Gonzalez, a 30-year-old Latina woman who came in 2 months after giving birth. She was bleeding heavily and felt dizzy. Dr. Castellano spent 12 minutes with her and told her it was normal postpartum anxiety. He sent her home with instructions to relax. She came back a week later. having nearly bled to death from complications that should have been caught immediately. Maya's hands shook as she kept searching. She found more cases. Not all of Dr. Castellano's patients of color received poor care, but enough of them did to form a pattern. And when she looked at how he treated white patients with similar symptoms, the difference was clear. They got more time, more tests, more attention, more belief. She was so focused on her research that she didn't notice Sofia Rodriguez, one of the emergency room nurses, standing behind her. "You see it too, don't you?" Sofia said quietly. Maya jumped, nearly knocking over her coffee. She quickly closed some of the windows on her screen. "Sofia, you scared me." "I'm sorry." Sofia looked around to make sure no one else was nearby. "But I've been watching you. Yesterday with that boy Marcus, I saw your face when Dr. Castellano sent him home. You knew something was wrong." Maya didn't know what to say. She barely knew Sofia except to say hello in passing. Sofia pulled up a chair and sat down next to Maya. "I've been working here for 5 years. I've seen things. Things I should have reported but didn't because I was scared." She paused, her voice dropping even lower. "Dr. Castellano isn't the only one, but he's the worst. The way he treats patients of color, especially black patients. It's different, colder, faster, less thorough. Have you ever said anything?" Maya asked. Sofia shook her head. "I tried once 2 years ago. I went to the nursing supervisor and told her I had concerns about how a patient was treated. You know what happened? Nothing. They said Dr. Castellano was an experienced physician who knew what he was doing. They made me feel like I was the problem, like I was seeing things that weren't there. After that, I kept quiet. I have 2 kids to feed. I can't lose this job." Maya understood. She had bills to pay too. She had always kept her head down for the same reason. But yesterday had changed something inside her. "That boy Marcus," Maya said. "I can't stop thinking about him. What if something happens to him?" "I know," Sofia said. "I've been thinking about him too. His symptoms were textbook appendicitis. Anyone with basic medical training could see that. But Dr. Castellano spent 3 minutes with him and sent him home." They sat in silence for a moment. Then Maya's computer beeped. She had gotten an email notification. It was from the hospital's patient feedback system. Maya's heart sank as she read the subject line. "Complaint regarding emergency department." She opened it. The complaint was from a woman named Jennifer Patterson. She wrote about bringing her son to the emergency room 2 days ago for severe stomach pain. She praised Dr. Castellano for his thorough examination and quick diagnosis. Her son had been admitted for emergency appendix surgery and was now recovering well. Maya pulled up the file. Jennifer Patterson's son was the white teenage boy who had come in after Marcus. The one Dr. Castellano had spent over 30 minutes examining. The one who got blood tests and a CT scan. "Look at this," Maya showed Sofia. Sofia read the email and shook her head. "Same symptoms, different treatment. The only difference is the color of their skin," Maya finished. Before they could talk more, the automatic doors opened. Maya's heart nearly stopped. It was Janelle Williams, and she was half carrying Marcus. The boy looked even worse than yesterday. His skin had a gray tint and he wasn't even trying to walk anymore. Maya jumped up from her desk. "Mrs. Williams?" "Please," Janelle gasped, tears streaming down her face. "Please help him. He's been getting worse all night. He can't stop throwing up. He's burning up. Something is really wrong." Maya grabbed a wheelchair and helped get Marcus into it. He was barely conscious, his eyes rolling back. "This was bad. This was really bad." "I'm getting help right now," Maya said. She ran to the nurse's station. "I need a doctor immediately. The patient from yesterday is back and he's critical." A nurse picked up the phone to page a doctor. Maya saw Dr. Castellano walking down the hallway. Her stomach turned, but he was the closest doctor. "Dr. Castellano," Maya called out. "Emergency patient needs immediate attention." Dr. Castellano walked over slowly, looking annoyed. When he saw it was Janelle and Marcus, his expression changed to something like anger. "You again?" he said to Janelle. "I told you yesterday your son just has a stomach bug. Taking up emergency room space for—" "With all due respect, doctor," Janelle interrupted, her voice shaking but firm. "My son can barely stay conscious. I am not leaving until someone actually examines him properly." Other people in the waiting room were starting to stare. Dr. Castellano's face reddened. "Mrs. Williams, I understand you're concerned, but some people just can't handle normal discomfort. Teenagers can be dramatic. He probably just needs rest and dramatic. Janelle's voice rose. You think my son is being dramatic? Look at him. Just look at him. Dr. Castellano glanced at Marcus dismissively. I examined him yesterday. My diagnosis stands. I recommend you take him home and— No. Janelle stepped between the doctor and her son. No, I want another doctor. I want someone else to look at him. This is not normal and you're wrong. Dr. Castellano's jaw tightened. Mrs. Williams, I don't appreciate you questioning my medical expertise. I've been practicing medicine for 15 years. I think I know a stomachache when I see one. Maya had heard enough. She couldn't stay silent anymore. She picked up the phone at her desk and dialed an extension. What are you doing? Dr. Castellano demanded. I'm paging another doctor, Maya said clearly, for a second opinion. You don't have the authority to. Actually, hospital policy states that patients have the right to request a second opinion at any time, Maya said, her heart pounding. I'm just facilitating that right. Dr. Castellano stared at her, his eyes cold and angry. But before he could respond, Dr. Lisa Okonkwo, another attending physician, came around the corner. Maya, you paged me? Dr. Okonkwo asked. Yes, doctor. This patient needs immediate evaluation. He came in yesterday with severe abdominal pain, fever, and vomiting. He was sent home. He's back today and his condition has deteriorated significantly. Dr. Okonkwo looked at Marcus and her expression changed immediately. She moved quickly, checking his eyes. Feeling his forehead pressing gently on his abdomen, Marcus groaned in pain. How long has he been like this? Dr. Okonkwo asked Janelle. Since yesterday afternoon, but it's gotten so much worse. Get me a gurney now, Dr. Okonkwo ordered. I want blood work, CT scan, and I want OR on standby. This patient is critical. Dr. Castellano stood frozen, watching as nurses rushed to help. Within minutes, Marcus was being wheeled to imaging. Dr. Okonkwo went with them, asking Janelle questions as they moved. Maya stood at her desk, shaking. Sophia came up beside her and squeezed her hand. You did the right thing, Sophia whispered. Dr. Castellano turned to look at Maya. His expression was cold and threatening. Without saying a word, he walked away. Maya sat down heavily in her chair. She had just challenged a senior physician in front of patients and staff. She had gone against hospital hierarchy. She might have just ended her career. But when she thought about Marcus's face, about Janelle's desperate plea for help, she knew she would do it again. Some things were more important than keeping quiet. Maya tried to focus on her work for the next hour, but her mind kept drifting to Marcus. She watched the emergency department board, tracking his progress through the system. Blood work, CT scan. The minutes crawled by. Finally, she saw Dr. Okonkwo emerge from the imaging area, walking quickly toward the surgical wing. Her face was serious. She stopped briefly at the nurse's station and Maya strained to hear what she was saying. Get surgery prep ready now, Dr. Okonkwo said urgently. His appendix has ruptured. We need to operate immediately. He's septic. If we had waited another hour or two. She didn't finish the sentence. Maya felt like someone had punched her in the stomach. Ruptured appendix. Septic. Those words meant Marcus had been in serious danger all along. Yesterday, when Dr. Castellano had sent him home with basic pain medication, Marcus had needed emergency surgery. The infection had been spreading through his body while he lay at home, suffering because a doctor hadn't believed him or his mother. Sophia appeared at Maya's desk, her face pale. Did you hear? Maya nodded, unable to speak. That boy almost died, Sophia whispered. If his mother hadn't brought him back today, if Dr. Okonkwo hadn't been here. She covered her mouth with her hand. Maya's hands were shaking. She looked around the emergency department. Everything looked normal. Patients waiting, staff moving efficiently, doctors making rounds. But underneath the surface of professional competence, something was very wrong. How many other patients had been dismissed? How many other families had been told they were exaggerating? I need to do something, Maya said quietly. Like what? Sophia asked. Maya, I saw how Dr. Castellano looked at you earlier. You embarrassed him in front of everyone. He's going to come after you. I don't care. You should care. He has friends in administration. His brother-in-law is on the hospital board. Do you know how many complaints have been filed against him over the years? Nothing ever happens. The hospital protects him. Maya looked at Sophia. How do you know about complaints? Sophia hesitated. Because I filed one of them. 2 years ago, like I told you, I documented everything about a patient he mistreated. I went through proper channels, talked to the nursing supervisor, filled out all the forms. You know what happened? They said there was insufficient evidence. They said differences in treatment approach don't constitute misconduct. 3 months later, I got a bad performance review for the first time in my career. My supervisor told me I needed to be more of a team player. They retaliated against you, Maya said. Not officially. Nothing I could prove. But the message was clear. Stop making trouble or things will get worse. Sophia glanced around nervously. Maya, I have kids. I need this job. I can't fight the system. Maya understood. She wasn't angry at Sophia. She was angry at a system that made good people stay silent to protect themselves. Her phone buzzed. She glanced at it and saw a text from an unknown number. This is Janelle Williams. The nurse gave me your number. Thank you for saving my son's life. The doctors say if we had waited much longer, he might not have made it. Thank you for not giving up on us. Maya's eyes filled with tears. She quickly wiped them away before anyone could see. Marcus was going to be okay. That was what mattered right now. But what about the next patient? What about all the patients who never came back, who suffered at home, who maybe didn't survive because they weren't given proper care? Maya finished her shift in a fog. She said goodbye to Sophia and walked to her car. She sat in the driver's seat for a long time, not starting the engine, just thinking. She thought about Mr. Thompson with his heart attack. She thought about Maria Gonzalez bleeding dangerously after childbirth. She thought about Marcus fighting for his life in surgery right now. She thought about all the cases she hadn't seen, all the patients she didn't know about. Maya pulled out her phone and started researching. She typed, "How to report medical discrimination" into her search engine. Pages of results came up. She read about filing complaints with hospital administration, with state medical boards, with federal agencies. She read about whistleblower protections. She read about retaliation. Then she found something that made her pause. She read several articles about healthcare workers who had exposed discrimination or malpractice. Some had been successful and brought about change. Others had lost their jobs, been sued, been blacklisted from the medical field. The risks were real, but so were the stakes. Maya thought about Janelle's face, the desperation and fear when she thought no one would help her son. She thought about how many other mothers might feel that same fear. Maya opened the Notes app on her phone. She had documented what she saw yesterday and today. But if she was going to do this, she needed to be smart about it. She couldn't violate patient privacy laws. She couldn't share protected medical information. But she could share what she observed. She could describe patterns. She could tell the truth about what happened in that emergency department. She started writing. She didn't use any names. She didn't share specific medical details. She wrote about a teenage patient with clear symptoms of appendicitis who was dismissed and sent home, only to return critically ill. She wrote about observing different treatment for different patients with similar symptoms. She wrote about the pattern she had noticed over the past year. Maya wrote for over an hour, sitting in her car in the hospital parking lot. She rewrote sentences to make sure she wasn't revealing anything that could identify specific patients. She focused on her observations as a hospital employee, on what she had witnessed with her own eyes. When she finished, she read it over 3 times. Her heart was pounding. If she posted this, there would be consequences. The hospital would investigate. They would probably figure out it was her. Dr. Castellano would know. Her job would be at risk, but Marcus almost died. That fact kept echoing in her mind. Maya created a new Twitter account. She didn't use her real name. She didn't include any identifying information. Then, taking a deep breath, she posted her statement as a thread. I work at a hospital. Today I watched a doctor dismiss a black teenage patient with obvious signs of appendicitis. He spent 3 minutes with the patient and sent him home. The patient came back 24 hours later, critically ill. His appendix had ruptured. He's in emergency surgery now. She continued the thread, describing the pattern she had observed, always being careful not to identify anyone. She included statistics she had found about racial disparities in pain treatment and emergency care. She talked about what she had learned about implicit bias in medical settings. Healthcare workers see these disparities but often stay silent because speaking up can cost them their careers. But how many patients have to suffer? How many have to die? At what point is silence more dangerous than speaking up? She finished the thread and hit post before she could change her mind. Then she turned off her phone and drove home. Maya barely slept that night. She kept reaching for her phone and then pulling her hand back. Finally, around 3 in the morning, she turned it on. Her Twitter thread had exploded. Thousands of retweets, thousands of comments. People sharing their own stories of medical discrimination. Healthcare workers thanking her for speaking up. Journalists asking for interviews. Civil rights organizations offering support. But there were also angry responses. People calling her a liar. People saying she was exaggerating. People accusing her of trying to destroy a doctor's career without evidence. Maya sat up in bed, her heart racing. This was bigger than she had expected. This was much bigger. By morning, local news outlets were reporting on the story. They couldn't identify her, but they were investigating claims of racial discrimination at Riverside Medical Center. The hospital had released a statement saying they took all concerns seriously and would be conducting an internal review. Maya got ready for work slowly. She knew today was going to be difficult. She knew there would be questions. But she also knew she had done the right thing. When she arrived at the hospital, the atmosphere was tense. Staff members were gathered in small groups whispering. Maya could feel people staring at her as she walked to her desk. Did they know it was her? She couldn't tell. She logged into her computer and saw an email from Human Resources. Her stomach dropped. Please report to HR at 10 a.m. for a meeting regarding yesterday's incident with Dr. Castellano. So it was starting. The retaliation Sophia had warned her about. Before she could think about it more, she saw Janelle walking toward her desk. The woman looked exhausted but relieved. He made it through surgery, Janelle said, tears in her eyes. Marcus is going to be okay. The surgeon said you saved his life by calling Dr. Okonkwo. If he had gone another few hours without treatment. She couldn't finish. Maya came around her desk and hugged Janelle. I'm so glad he's okay. I don't understand why that first doctor didn't help us, Janelle said quietly. I kept thinking, was it something I said? Was I not clear enough? Did I not explain it right? She paused. But then I thought about other times, other doctors, other situations where I felt like I wasn't being heard. And I started to wonder if it was something else. Maya looked at Janelle. It wasn't your fault. You did everything right. The problem wasn't you. Janelle nodded slowly. I know, I think I've always known. But it's hard to admit, you know? It's hard to accept that someone might not help your child because of what you look like. They stood together for a moment. Two women who had witnessed something that shouldn't happen but happened far too often. Whatever happens next, Janelle said. Thank you. Thank you for seeing us. Thank you for helping when someone else wouldn't. After Janelle left, Maya sat at her desk and waited for 10 a.m. She didn't know what would happen in the HR meeting, but she knew one thing for certain. She would not apologize for saving a child's life. At exactly 10 o'clock, Maya walked into the Human Resources office. Her palms were sweating, but she kept her head high. The HR director, a woman named Patricia Hendricks, sat behind her desk with a tight smile. Next to her sat the hospital's legal counsel, a man Maya had never met before. Please, sit down, Ms. Chen, Patricia said. Maya sat, folding her hands in her lap to keep them from shaking. I assume you know why you're here, Patricia continued. Yesterday you paged Dr. Okonkwo for a patient who was already under Dr. Castellano's care. You undermined his medical authority in front of patients and staff. A patient was in critical condition, Maya said quietly. The patient's mother requested a second opinion, which is her right under hospital policy. Dr. Castellano had already examined the patient the day before and provided a diagnosis and treatment plan, the legal counsel said. By going over his head, you suggested his medical judgment was incorrect. His medical judgment was incorrect, Maya said, meeting their eyes. That patient is currently recovering from emergency surgery for a ruptured appendix. If he hadn't received treatment when he did, he might have died. Patricia and the lawyer exchanged glances. The outcome doesn't change the fact that you overstepped your role. You're a receptionist, not a doctor. You don't have the medical training to question a physician's decisions. I don't need medical training to see that a patient is suffering and needs help. Ms. Chen, we need to discuss something else. Patricia pulled out a printed copy of Maya's Twitter thread. Are you the author of this? Maya's heart raced, but she kept her face calm. That account doesn't have a name on it. No, but it describes incidents that occurred at this hospital. The timeline matches exactly with yesterday's events. There are details that only a hospital employee would know. I can't control what anonymous people post on the internet, Maya said carefully. The lawyer leaned forward. Ms. Chen, if you are the author of these posts, you may have violated hospital confidentiality policies. You may have also defamed Dr. Castellano by implying he provides substandard care based on race. That thread doesn't name any doctor or any specific patient, Maya replied. It describes general observations about patterns of care. There's no confidential medical information in it. The implication is clear, Patricia said, and now there are news reporters calling the hospital, asking questions about racial discrimination. This is creating a serious problem for us. Maybe the problem already existed, Maya said quietly. Maybe I just pointed it out. Patricia's face hardened. Ms. Chen, I'm going to be direct with you. Dr. Castellano is a respected physician with 15 years of excellent service. He's filed a complaint against you for harassment and insubordination. If this Twitter account is yours, and if you continue to make these accusations, you will be terminated. Do you understand? I understand that you're more concerned about protecting the hospital's reputation than protecting patients, Maya said. That's not fair, Patricia said. We take patient care very seriously. Do you? Maya felt something break loose inside her. All the fear, all the careful silence, all the time she had looked away. It was over. Then why haven't you investigated the complaints that have been filed against Dr. Castellano over the years? Why haven't you looked at the pattern of how he treats patients of color versus white patients? Why is your first response to threaten me instead of asking if what I observed is true? The room fell silent. The lawyer started writing notes. This meeting is over, Patricia said coldly. You're suspended pending investigation. You'll receive information about our findings within 2 weeks. Until then, you're not to come to the hospital or contact any staff members. Security will escort you out. Maya stood up. Her legs felt weak, but she walked to the door with her head high. A security guard was waiting outside. He walked with her to her desk, where she gathered her personal belongings. Other staff members watched silently. Sophia was there, tears in her eyes, but she didn't speak. As Maya walked out of the hospital, she felt strangely calm. She had known this might happen, but she had also known she couldn't stay silent. She drove home and sat on her couch staring at her phone. The Twitter thread had spread even further. News outlets were picking up the story. Civil rights organizations were calling for investigations. The hashtag Riverside Medical Center was trending. Her phone rang. It was a number she didn't recognize. She almost didn't answer, but something made her pick up. Hello? Hi, is this Maya Chen? A woman's voice asked. Who is this? My name is Angela Torres. I'm an attorney with the Civil Rights Legal Defense Fund. I've been following the story about Riverside Medical Center. I'd like to talk to you about what you witnessed. Maya hesitated. How did you get my number? I have connections, Angela said. Look, I understand you're probably scared. You have every right to be, but what you've described, if it's true, is a serious civil rights violation. Patients deserve equal treatment regardless of their race, and healthcare workers who speak up deserve protection. I'm suspended from my job, Maya said. That's retaliation, and it's illegal. If you're willing to work with us, we can help protect you and investigate what's really happening at that hospital. Maya thought about Mr. Thompson, about Maria Gonzalez, about Marcus lying in a hospital bed recovering from surgery he should have had a day earlier. What would I need to do? Maya asked. First, document everything. Every interaction with HR, every email, every conversation. Second, we'd need you to make a formal statement about what you've observed. Third, you'd need to be prepared for this to get harder before it gets better. Hospitals don't like being exposed. They have money and lawyers, and they will fight back. I don't have money for lawyers. We work pro bono on cases like this. You wouldn't pay us, but you would need to be strong. Can you do that? Maya thought about Janelle's face when she thought no one would help her son. Yes, she said. I can do that. Over the next few days, Maya worked with Angela and her team. She provided detailed statements about everything she had witnessed. She pulled records of her own observations, timestamps, notes she had taken. She was careful to avoid revealing protected medical information, but she documented patterns, treatment differences, and the outcomes she had seen. Angela's team interviewed other current and former staff members. Slowly, more people started coming forward. A nurse who had been fired after questioning Dr. Castellano's treatment of a Latino patient, a physician's assistant who had noticed the same patterns but had been told to keep quiet, a janitor who had overheard Dr. Castellano making racist comments about patients, but not everyone supported Maya. The hospital released a statement defending Dr. Castellano and suggesting that the anonymous social media posts were based on misunderstandings and contained no credible evidence. Some staff members gave interviews praising Dr. Castellano, talking about what a skilled doctor he was. Maya started receiving messages. Some were supportive, thanking her for speaking up, but others were threatening. Anonymous emails telling her she had ruined a good doctor's career. Phone calls in the middle of the night with no one speaking on the other end. Someone left a note on her car that said, "Snitches get stitches." She reported everything to Angela and to the police. The threats were documented, but they still scared her. One evening, Sophia called her. "Maya, I'm sorry I didn't speak up in that meeting," Sophia said. "I was scared." "I understand," Maya replied. "You have kids to think about." "I do. But I've been thinking about what you said, about how many patients have to suffer, about when silence becomes more dangerous than speaking up." She paused. "I talked to a lawyer. I'm going to give a statement too, about what I've seen over the years." Maya felt tears in her eyes. "Sophia, you don't have to do this." "Yes, I do. You were brave enough to go first. The least I can do is back you up." More people started coming forward. The state medical board announced they were opening an investigation into Dr. Castellano's practice patterns. Federal investigators from the Department of Health and Human Services contacted the hospital about potential civil rights violations. Riverside Medical Center fought back hard. They hired a major law firm. They conducted their own internal investigation, which concluded that there was no evidence of discrimination and that all treatment decisions were based on sound medical judgment. But then Angela's team obtained something crucial. They filed a legal request for data on Dr. Castellano's patient outcomes over the past 5 years. The numbers were striking. Patients of color under Dr. Castellano's care waited an average of 42 minutes longer to see him than white patients with similar conditions. They received diagnostic testing at 38% lower rates. They were sent home without admission at 56% higher rates. And their rates of return visits within 48 hours for the same condition were 73% higher. The data told a clear story. When Angela released these findings to the media, the story exploded nationally. Maya watched the news coverage from her living room. She saw Dr. Castellano's photo on the screen. She saw the hospital administration giving press conferences. She saw activists protesting outside Riverside Medical Center, demanding accountability. And she saw other stories starting to emerge. Healthcare workers from other hospitals sharing similar experiences. Patients of color describing times when they felt dismissed or not believed. A national conversation beginning about racial bias in medical treatment. Her phone rang. It was Janelle. "Marcus wanted me to call you," Janelle said. "He's home from the hospital now, recovering well. He wanted you to know that what you did mattered. Not just for him, but for everyone." "How is he?" Maya asked. "Angry," Janelle said honestly. "He keeps asking why the doctor didn't help him the first time." "I don't know how to explain racism to a 16-year-old. I don't know how to tell him that some people see his skin color before they see his pain." "I'm sorry he has to learn that lesson," Maya said. "Me too, but I'm glad he's alive to learn it, thanks to you." After they hung up, Maya sat in silence. She had lost her job. She had received threats. Her name was being discussed on national news. Her life had been turned upside down, but Marcus was alive. And maybe, just maybe, the next patient would be treated fairly. Maybe the next mother wouldn't have to beg for someone to help her child. That night, Maya finally slept soundly for the first time in weeks. 3 weeks after Maya's suspension, the state medical board held a formal hearing. Maya sat in the waiting room with Angela Torres, her attorney, watching people come and go. Other patients who had filed complaints against Dr. Castellano were there. Staff members who had witnessed concerning incidents were there. Even some of Dr. Castellano's colleagues who had grown uncomfortable with what they had seen were there. Dr. Castellano arrived with his own team of lawyers. He walked past Maya without looking at her, his face set in a hard expression. The hearing lasted 3 days. Maya testified about what she had observed, always careful to stick to facts and specific incidents. She described Marcus's case in detail, the timeline, the symptoms, the treatment he received versus what other patients received. Dr. Castellano's lawyers tried to attack her credibility. They pointed out she had no medical training. They suggested she had a personal vendetta against their client. They claimed she had violated patient privacy and hospital policies. But then Dr. Lisa Okonkwo testified. She explained that when she examined Marcus, his condition was critical. His appendix had already ruptured. He had developed peritonitis, a dangerous infection of the abdominal cavity. Another few hours and he likely would have died or suffered permanent organ damage. The symptoms presented were classic for acute appendicitis, Dr. Okonkwo said. Any competent physician should have recognized them and ordered appropriate testing. The standard of care for a patient with those symptoms is immediate diagnostic imaging and laboratory work, not sending them home with over-the-counter pain medication. Sofia Rodriguez testified next. She described multiple incidents she had witnessed over her 5 years at the hospital. She had kept her own private notes documenting dates, times, and patient reactions. Her voice shook as she spoke, but she didn't back down. I was told to be a team player, Sofia said. I was told that questioning a doctor's judgment was insubordinate. But I watched patients suffer because I stayed silent. I can't do that anymore. More witnesses came forward. Mr. James Thompson, the elderly man who had nearly died from a heart attack after being sent home with antacids. Maria Gonzalez, the new mother who had almost bled to death. A young black woman who had been told her severe migraines were just stress, only to discover weeks later she had a brain aneurysm. The statistical evidence was presented, the data showing clear disparities in treatment times, diagnostic testing, and patient outcomes. Dr. Castellanos' lawyers argued that statistics could be misleading, that there might be other explanations for the differences. But then an expert witness, Dr. Michelle Chen, a researcher who studied healthcare disparities, testified about implicit bias in medical settings. Implicit bias doesn't mean a doctor consciously decides to provide worse care to patients of color, Dr. Chen explained. It means unconscious associations and attitudes affect their medical judgment. They might spend less time with patients of color. They might be more skeptical of their pain reports. They might order fewer tests. The doctor might not even realize they're doing it. But the outcome is the same, unequal care that can lead to serious harm. She presented research showing that black patients' pain was often undertreated compared to white patients, that black women were 3 times more likely to die in childbirth than white women, that implicit bias training had been shown to improve patient outcomes. The hearing concluded, and everyone waited for the medical board's decision. It would take several weeks, they were told. In the meantime, the federal investigation continued. The Department of Health and Human Services sent investigators to Riverside Medical Center. They reviewed hundreds of patient records looking for patterns of discrimination. Maya remained suspended. Bills were starting to pile up. She had savings, but they wouldn't last forever. Angela's organization helped her file a wrongful termination complaint against the hospital, but that process would take months, maybe years. Support came from unexpected places. A crowdfunding campaign started by someone Maya had never met raised enough money to cover her expenses for several months. Other healthcare workers reached out to share their own stories. Patient advocacy groups invited her to speak about her experience, but there was also backlash. Some people in her community criticized her for causing trouble. A family friend told her mother that Maya was destroying a good doctor's reputation over nothing. Her mother called worried, asking if Maya was sure she was doing the right thing. "I'm sure, Mom," Maya said. "A teenage boy almost died because a doctor didn't believe him. How can I stay silent about that?" Her mother was quiet for a moment. "Your father and I, when we first came to this country, we learned to keep our heads down. Don't make trouble. Work hard, don't complain. That's how we survived. I know, Mom, and I understand why. But keeping our heads down means other people keep suffering. At some point, someone has to speak up." "I'm proud of you," her mother said finally, "and I'm scared for you." Both things can be true at the same time. 6 weeks after the hearing, the medical board announced their decision. They found that Dr. Castellano had violated the standard of care in multiple cases. They found evidence of disparate treatment based on race. They suspended his medical license for 1 year and required him to complete bias training and supervised practice before he could return to medicine. It wasn't everything Maya had hoped for. She had wanted his license permanently revoked. But it was something. It was acknowledgement that what she had witnessed was real and wrong. The hospital's response came next. Riverside Medical Center released a statement saying they took the medical board's findings seriously and were committed to providing equal care to all patients. They announced new policies: mandatory implicit bias training for all staff, a patient advocacy hotline where concerns could be reported anonymously, and a diversity and inclusion committee to review patient care protocols, but they still didn't reinstate Maya. Her suspension remained in place while they completed their internal investigation. Angela filed a motion to force the hospital to make a decision: either officially fire Maya and face a wrongful termination lawsuit, or reinstate her with back pay. The hospital's lawyers tried to delay, but the judge wasn't having it. Ms. Chen has been in limbo for 2 months, the judge said. The hospital needs to make a decision. Either she violated policies and should be terminated, or she didn't, and should be reinstated. You have 1 week to decide. Maya waited anxiously. She had no idea which way it would go. Part of her wasn't even sure she wanted to go back to Riverside. How could she work at a place that had tried to silence her? How could she face colleagues who had turned against her? But another part of her knew that going back would mean something. It would mean she had won. It would mean they couldn't bully her into silence. The call came on a Friday afternoon. It was Patricia from HR. Ms. Chen, after completing our investigation, we've decided to reinstate you with full back pay. Your suspension is lifted effective immediately. Maya couldn't speak for a moment. Why? She finally asked. Patricia's voice was formal, careful. Our investigation found that you acted in accordance with hospital policy regarding patient advocacy and second opinion requests. While we would have preferred different communication methods, we recognize that patient safety was your primary concern. It was a carefully worded non-apology. The hospital was covering itself legally while trying to look like they were doing the right thing. What about Dr. Castellano's complaint against me? Maya asked. That complaint has been withdrawn. Maya understood. The hospital had made a deal. Reinstate her to avoid a lawsuit and bad publicity, but make Dr. Castellano withdraw his complaint so they didn't have to officially admit wrongdoing. When do I start? Maya asked. Monday, if you're willing. Maya thought about it. She could refuse. She could find another job. But if she left, would anything really change? Or would the hospital just wait for things to blow over and go back to business as usual? I'll be there Monday, Maya said. But I have some conditions. Conditions? I want to be part of the patient advocacy committee. I want input on the new policies you're implementing, and I want protection against retaliation written into my employment contract. There was a long pause. I'll need to discuss this with administration. That's fine. Let me know by Sunday, otherwise I'll see you in court. Maya hung up feeling stronger than she had in months. She had learned something important. When you speak up, even when it's scary, even when it costs you something, you find power you didn't know you had. Sunday evening, she received an email. The hospital agreed to all her conditions. Monday morning, Maya walked back into Riverside Medical Center. She felt everyone's eyes on her as she crossed the lobby. Some people looked away. Others nodded at her with respect. Sophia was waiting at the reception desk, a huge smile on her face. Welcome back, Sophia said, hugging her. It feels strange being here, Maya admitted. I know, but I'm glad you came back. We need people like you here, people who won't stay silent. Maya sat down at her familiar desk and logged into her computer. Everything looked the same, but everything felt different. She was different. She had learned that doing the right thing wasn't always easy, but it was always worth it. An elderly black woman came through the automatic doors, supporting her husband who was clutching his chest. Maya immediately stood up. I need help, the woman said. My husband has chest pain. Maya grabbed a wheelchair. I'm calling a doctor right now. We're going to take care of him. She paged the on-duty physician and made sure the man was taken back immediately for examination. She watched as the doctor spent time with him, ordered an EKG, and called for a cardiology consult. This was what it should look like. This was how it should always work. Later that afternoon, Dr. Okonkwo stopped by Maya's desk. It's good to have you back, Dr. Okonkwo said. What you did took courage. I was just doing what was right, Maya replied. That's exactly what courage is. Doing what's right even when it's hard. Dr. Okonkwo paused. I wanted you to know that Marcus is doing well. He's back in school. His mother told me he wants to become a doctor now. He says he wants to be the kind of doctor who believes his patients. Maya felt tears in her eyes. That's wonderful. It is. And it happened because you didn't look away. You saw something wrong and you did something about it. That matters more than you know. After Dr. Okonkwo left, Maya sat at her desk and thought about everything that had happened. She had lost weeks of income. She had been threatened. She had been suspended and investigated. Her name had been in the news. Her life had been turned upside down, but Marcus was alive. Sophia had found her voice. Other healthcare workers were speaking up about bias they had witnessed. The hospital had been forced to change its policies. The medical board had taken action. Maya knew this wasn't the end. There would be more challenges. Change didn't happen overnight. But for the first time in her life, she understood what it meant to be part of making that change happen. She answered the phone, greeted the next patient, and got back to work. There were people who needed help, and she would be there to make sure they got it. 6 months after Maya returned to work, she stood in a conference room at Riverside Medical Center. Around her sat the newly formed Patient Advocacy and Equity Committee. The committee included nurses, doctors, administrators, and 2 community representatives. Maya had been appointed as the committee's vice chair. Today we're reviewing the data from our first quarter of the new patient care protocols, Dr. Okonkwo said, pulling up a presentation on the screen. The results are encouraging. The numbers showed real change. Average wait times for patients of color had decreased by 38%. Diagnostic testing rates were now equal across racial groups. Patient satisfaction scores among minority patients had increased significantly. Return visit rates for the same condition had dropped. These improvements are meaningful, Dr. Okonkwo continued. But we need to remember that data only shows us part of the story. Maya, do you want to share what you've been hearing through the advocacy hotline? Maya stood up. Over the past 6 months, she had been managing the anonymous patient advocacy hotline that the hospital had created. Patients could call or text to report concerns about their care without fear of retaliation. We've received over 300 calls, Maya said. Most are simple issues that get resolved quickly. But we've identified 12 cases that required serious intervention. Patients who felt dismissed, who weren't being heard, who noticed they were treated differently than other patients. She pulled up her own presentation. In each case, we were able to connect the patient with a patient advocate who helped address their concerns. In 3 cases, we identified physicians who needed additional bias training. In 2 cases, we caught serious medical errors before they caused harm. One of the administrators shifted uncomfortably. That's 12 cases where staff members made mistakes. That doesn't look good for the hospital. Actually, Maya said carefully, it's 12 cases where the hospital's new system worked exactly as it should. We identified problems and fixed them. Before, these patients would have just suffered in silence or maybe filed lawsuits later. Now we're catching issues early. Sophia, who had been promoted to the committee as the nursing representative, spoke up. I've seen the change on the floor. Staff members are more aware now. They're questioning their own assumptions. They're asking themselves if they're treating all patients equally. That awareness alone makes a huge difference. The committee discussed new training programs, updated protocols, and ways to continue measuring progress. It wasn't perfect. Change was slow and sometimes frustrating, but it was happening. After the meeting, Maya returned to her desk in the emergency department. Things had changed there too. The hospital had hired 2 new patient advocates who worked in the ER specifically to help patients navigate the system and ensure their concerns were heard. A young Latino man came to Maya's desk, looking nervous. Hi, I'm here because my daughter has been having bad headaches. We saw a doctor last week and he said it was nothing, but she's getting worse. Maya immediately recognized the situation. A patient sent home but getting worse. A parent worried they weren't being believed. Let's get her checked in right away, Maya said. And I'm going to have one of our patient advocates come talk with you to make sure all your concerns are addressed. Okay, the man's face relaxed with relief. Thank you. I was worried we'd be turned away again. Not here. Not anymore, Maya said firmly. She processed the intake and made sure the family was seen quickly by a thorough physician. The patient advocate stayed with them throughout the examination. Later, Maya learned that the girl was diagnosed with a serious condition that required immediate treatment. Because they caught it early, the outcome would be much better. During her lunch break, Maya checked her phone. She had been invited to speak at a national healthcare conference about patient advocacy and addressing bias in medical settings. It was the 5th such invitation she had received in the past few months. She had become known in healthcare circles as the receptionist who exposed racial bias at her hospital. Some people praised her, others criticized her, but everyone knew her story. Her phone buzzed with a text from Janelle. Marcus got accepted to his top choice college. He's going to major in pre-med. He still talks about you. Says you taught him that standing up for what's right matters more than staying safe. Maya smiled and texted back congratulations. Marcus had become an activist himself, speaking at local high schools about his experience and about racial disparities in healthcare. He had turned his trauma into purpose. That evening, Maya attended a community forum on healthcare equity. The room was packed with patients, healthcare workers, and activists. She was one of the speakers, along with Dr. Okonkwo and several other people who had been involved in the case against Dr. Castellano. Dr. Castellano himself had completed his 1-year suspension and bias training. He had applied to several hospitals for new positions, but so far none had hired him. His reputation had been permanently damaged. Some people said this was unfair, that one mistake shouldn't ruin a career. Others said it was justice for years of harm. Maya tried not to think about Dr. Castellano too much. She focused on systems, not individuals. The problem wasn't just one bad doctor. It was a system that allowed bias to flourish, that protected powerful people, that silenced those who spoke up. The most important lesson I learned, Maya told the audience, is that change requires both individual courage and collective action. I spoke up first, but I couldn't have done anything alone. Sophia and other healthcare workers came forward. Patients shared their stories. Lawyers and activists helped investigate. Journalists reported the truth. It took all of us. She continued, and we can't stop now. Riverside Medical Center has made improvements, but one hospital changing doesn't fix the whole healthcare system. This problem exists everywhere. Bias exists in every hospital, every clinic, every medical practice in this country. We need more people to speak up. We need more people to demand better. After the forum, people came up to thank Maya. Some shared their own stories of being dismissed by doctors. Others said they worked in healthcare and were inspired to be more vigilant about their own biases. A young black woman approached Maya, tears in her eyes. My brother died 3 years ago because a doctor didn't believe he was really in pain. He had sickle cell disease and he went to the ER during a pain crisis. They thought he was drug-seeking. By the time they actually treated him, it was too late. She took a shaky breath. Hearing your story, it helps me understand what happened. And it gives me hope that maybe it won't happen to someone else's brother. Maya hugged the woman, feeling the weight of all the stories she had heard over the past months. So many people harmed by bias. So many families who had lost loved ones. So many patients who had suffered needlessly. She thought about all the patients she hadn't seen, all the cases she didn't know about. How many people had suffered in silence? How many had died because they weren't believed? But she also thought about the changes that had happened. The patients who were now getting better care. The healthcare workers who were speaking up when they saw problems. The policies that were being changed across the country, inspired partly by what happened at Riverside. A few weeks later, Maya received a call from the medical board. They wanted her input on developing statewide standards for patient advocacy in hospitals. They wanted to know what had worked at Riverside and what hadn't. We're recommending that every hospital in the state implement anonymous reporting systems and patient advocacy committees, the board representative said. Your case showed us how important it is to have mechanisms for patients and staff to report concerns without fear. Maya felt a surge of pride. What had started as one woman refusing to stay silent had grown into systemic change. She continued her work at Riverside, but she also began consulting with other hospitals that wanted to improve their equity practices. She trained new patient advocates. She taught healthcare workers how to recognize their own biases. She spoke to medical students about the importance of believing and respecting all patients equally. 1 year after everything began, the hospital held a ceremony honoring Maya and others who had contributed to improving patient care. The CEO gave a speech about Riverside's commitment to equity and excellence. Maya sat in the audience feeling mixed emotions. She was glad the hospital had changed, but she also remembered how hard they had fought against that change. She remembered being suspended, threatened, and treated like she was the problem instead of the solution. After the ceremony, Sophia found her. How are you feeling? Sophia asked. Complicated, Maya admitted. I'm proud of what we did, but I also know we only succeeded because we refused to give up. If we had listened to HR that first day, if we had stayed silent like they wanted, nothing would have changed. That's true, Sophia agreed. Sometimes I think about how close we came to just accepting things as they were. How easy it would have been to look away. But we didn't, Maya said, and that matters. They stood together, watching hospital staff and community members mingle at the reception. Maya saw Dr. Okonkwo talking with a group of medical students, probably telling them about the importance of patient advocacy. She saw Janelle and Marcus, who had been invited to the ceremony. Marcus was talking animatedly with some of the younger staff members. Maya thought about the journey she had been on. A year ago, she had been a quiet receptionist who kept her head down and didn't make waves. Now she was a patient advocate, a speaker, a consultant, and a voice for change. It hadn't been easy. She had lost sleep, money, and peace of mind. She had been threatened, criticized, and investigated. Her life had been turned upside down. But Marcus was alive and healthy and going to college. The patient advocacy hotline had helped hundreds of people. Hospital policies had changed, not just at Riverside, but at hospitals across the state. Healthcare workers everywhere were more aware of their biases and more committed to treating all patients equally. A young receptionist who had just been hired approached Maya nervously. "Hi, Ms. Chen. I just wanted to say that you're the reason I applied for this job. I heard your story and I thought, if she could make a difference as a receptionist, maybe I can too." Maya smiled. "You can, and you will. Just remember, speaking up isn't easy. It might cost you something. But staying silent costs everyone much more." The young woman nodded seriously. "I'll remember that." As the ceremony ended and people began to leave, Maya stood for a moment in the hospital lobby looking around. This was where it had all started, right here at the front desk, watching a mother beg for help for her son. She thought about all the moments when she could have made different choices. She could have stayed silent. She could have told herself it wasn't her business. She could have let fear stop her, but she had chosen courage instead, and that choice had changed everything. Maya walked toward the exit, ready to go home. Tomorrow she would be back at work, answering phones, checking in patients, and making sure everyone got the care they deserved. She would keep advocating, keep speaking up, keep pushing for change, because she had learned something important. One person speaking up can start a movement. One person refusing to accept injustice can inspire others to do the same. One person believing that patients deserve equal care, regardless of the color of their skin, can help transform an entire system. As she pushed through the doors into the cool evening air, Maya felt something she hadn't felt in a long time. She felt hopeful, not because everything was perfect, but because change was possible. Not because the fight was over, but because people were fighting. She got in her car and drove home, thinking about tomorrow. There would be more patients who needed help. More situations where someone would need to speak up. More opportunities to make a difference, and Maya would be ready. Because she had learned that being brave doesn't mean not being afraid. It means being afraid and speaking up anyway. It means seeing something wrong and refusing to look away. It means believing that one person's voice raised in truth can echo far beyond anything they imagined. The sun was setting as Maya pulled into her driveway. She sat for a moment, watching the orange and pink colors spread across the sky. Tomorrow would bring new challenges, new opportunities, new chances to make a difference. But tonight, she rested in the knowledge that she had done what was right. And that in the end was what mattered most.